Lawrence and Adina, it's so good to see both of you. How are you feeling, Lawrence?
Hi, good morning, Savannah. I'm thankful that I'm alive, to be honest with you. It's been quite a journey.
We're happy to see you and hear you. And Adina, you must be so happy to be sitting next to your husband and knowing that he's on the road to recovery.
Oh, absolutely, without a doubt. Feeling very blessed.
50-year-old attorney and devoted family man Lawrence Garbuz was one of the first people in the New York area to test positive for coronavirus. His case sparking a community outbreak in the city of New Rochelle.
New Rochelle is a significant hotspot.
In an effort to control the spread, a containment area was created around his neighborhood. Schools and places of worship shut down, and the National Guard moved in. But when Garbuz first started feeling sick back in February, the coronavirus was the last thing on anyone's mind. When did you first notice, Lawrence, that you were not feeling well?
I had a cough, a slight cough. One night I woke up, and this was a few days before the diagnosis, and I had a fever. It was a low-grade fever. I had no intention of going to work. I went to the doctor, and he examined me, and he said I needed to go immediately to the emergency room.
Was coronavirus something that was even on your mind, or did you just think, maybe I've got the flu or a bad cough?
No, it really wasn't on my mind. I just thought I had a cough. Look, I'm a lawyer. I sit at a desk all day. I think at the time we were sort of focusing on individuals who maybe had traveled internationally, something that I had not done. I certainly had not been to China, never have been.
Did coronavirus even come up when you went to that first visit to the doctor?
Not at all. There was no mention of it at all.
And you went to the hospital, and what happened next?
After we entered the emergency room, I have absolutely no recollection of anything that transpired until I woke up from the coma. So it's as if 3 weeks of my life had completely disappeared and I was asleep for all of it.
That's shocking.
We thought, okay, you have pneumonia, you know, we get some medicine, you come home. And over the weekend, it increasingly got worse and worse. He was struggling to breathe. I was trying to keep him calm. You know, you feel awful and scary.
It seems like he just deteriorated so fast.
Healthy, vibrant person all of a sudden overnight gets so sick so quickly. I know that at this point we're not so surprised by that, but at that time it was shocking.
And did he have any pre-existing conditions? Was there any reason to think now, oh, that's why it hit him so hard?
There are no pre-existing conditions or health. I do think that he was working very hard. He was very busy and very tired, and maybe that contributed.
You made this important decision to transfer him to a bigger hospital in the city. I know, Adina, you were instrumental in making sure that he was intubated to help him breathe on that ambulance ride. Why was that so important?
He was suffering, and I couldn't watch it. I'm looking at him, and I just didn't think he was going to make an ambulance ride in that state.
Lawrence, do you feel like she may have saved your life in that moment?
Absolutely. My wife saved my life. She is a person who solves problems quickly with a smile.
Those weeks that you were in the coma, Lawrence, were so difficult for your family, and they can't be by your bedside. Adina, I know that really weighed on you.
I think that's what weighed on me, obviously, other than his coming out to the other side and recovering. That is 100% what weighed on me the most. You wake up and you're alone, and who's the first thing you want to see is your family.
Lawrence, what has your family meant to you during these hard days?
Well, there's no doubt that my children and my wife sort of helped me get through this. Even though I was not able to see them, somebody had the foresight to place in my room pictures of my children, and I was able to look at them every single day, and my goal was to go home, and that was my only goal.
Tell me about how the doctors and nurses cared for you, Lawrence.
Both the doctors and the nurses, they just did an absolutely splendid job. Many nurses came into the room, and they really were very compassionate. There was one person in particular, she said that, Lawrence, I was praying for you, and I was just hoping that you were going to make it. Individuals like that who really help you recover.
Adina, what do you remember about that first conversation after he woke up from the coma?
All he cared about with his family. I mean, the first words he said to me was, "I love you." That's it.
It's a lot. It's a lot to take in. It's a lot to go through. And then for you, you were also at the center of it publicly. What has it been like to be known as one of the very first patients to have coronavirus in this country?
Really have not focused on any of the media frenzy in terms of one of the first patients to get it, but I have been focused more on, as I say, getting better.
Your community, New Rochelle, had to be shut down. It was actually, you had the National Guard there. What would you want people to know about what you guys did the minute you found out that Lawrence had COVID-19?
It was most important to me to make sure that everybody was safe. I got the diagnosis at 9 o'clock at night, and I basically was on the phone through the night with various departments of health, finding out what to do, sharing everywhere we went. That was most important. I didn't want anybody else to get sick. I mean, I knew what we were going through, and I didn't want anybody else to do that.
So what would you want people to know about you and this journey that you've been on?
I think that I appreciate life a lot more. I think every day is an absolute gift that God has given every one of us to enjoy, that we need to appreciate our family and our friends and to live life.
And I know family is so important to you. I was hoping we could meet your kids. I know they're there with you. What does it mean to you to have your dad home with you, feeling good after everything you all have been through as a family?
This is just like a miracle for all of us. It was obviously very, very scary, and we didn't know what was going to happen. You know, to have him home has been huge for us.
My birthday was approaching, and people asked me, like, I know it's a strange birthday, like, what would you like? And it was very obvious to me. I would like my father to come home. And now he's home, and it's truly amazing.
Lawrence and Adina, you have everything that means everything to you surrounded by you right now. How does it feel?
Well, it feels great. It really feels wonderful.
I'm feeling blessed.
It's so interesting. You know, I'm sure you guys remember when we first started covering coronavirus, and then there was this patient zero in New Rochelle, this lawyer, and now he has a name and a face and a family, and most importantly, a survival story. And he has no idea how he got the virus. He's like, I'm a lawyer sitting in an office. I have no idea how I got it.
Wow. Well, when you watch their relationship and Adina, how she never stopped. I mean, it's so obvious how wonderful she is in that story. That was great, Savannah.